My name's Dr. Laurence Mermelstein. I'm an orthopedic spine surgeon here at Long Island Spine Specialists. And my memories of Brielle Newman date back to when she was 5 or 6 years old. She first presented to me already in a brace for scoliosis. She was diagnosed with juvenile idiopathic scoliosis. Always remember her coming into the office, either coming from or going to basketball practice, always giving us, myself and her mom, a hard time wearing her brace.
So I had spinal fusion surgery to correct my scoliosis. I'm very athletic, so hearing that I had to have surgery was kind of like a deal breaker.
But given Brielle's high activity level and her love of athletics, we had to make some surgical decisions regarding the best way and type of correction to make. This is the preoperative X-ray of Brielle's spine, which shows the spinal curvature. This is the right side of the spine, left side of the spine. Now normally when you look at somebody's spine from this direction, you see vertebrae which are lined up in a straight line. These fixtures are what we call pedicle screws that are rigidly anchored into the vertebra. These rods span each of the screws and hold the vertebra in a corrected position, allowing the vertebra to fuse to each other. And obviously in this particular model, the spine is straight and is being held straight with these screws and rods. All right, so this is Brielle's X-ray after surgery, which depicts the screws and rods. The screws, as you can see, are anchored into the vertebra with 2 rods. This is called a selective right thoracic fusion. And I think performing her surgery in this fashion, whereas her lower spine isn't perfectly straight, allowed her mobility in her low back, which otherwise would not have been possible if she had a fusion performed from her thoracic all the way down into her lumbar spine.
The surgery was awesome, honestly. I always say it's probably the best thing I ever did because I feel so awesome after and almost like nothing ever happened. The guy is awesome. He relates to the patients, and I think one thing that I always loved about him, I feel like we always joke around and have this funny sense of humor with each other. After the surgery, once I came out of it, I went back to doing everything I had always loved to do. I played soccer, basketball, badminton even, so a few different random things in there. But yeah, everything was fine after the surgery and went back to doing everything as normal.
Scoliosis is a very common deformity that we see in adolescents, and eventually adolescents grow up into adults. And my goal in treatment is to not allow any adolescent to grow up into a young adult with a severe curvature. But the message is that if a child is diagnosed with scoliosis, they should at least be evaluated and followed. Modern scoliosis surgery now involves smaller incisions, more rapid recovery, higher healing rates, lower complication rates, and more rapid return to sports and other activities.